almost half of more than 4 million South Africans who live with diabetes don't know they have the disease. It's the #1 killer of women in the country. But apart from the health concerns, diabetes is also thought to cost the country nearly 70 billion rand. This due to medical procedures. The chairperson of the South African Diabetes Alliance, Dr. Patrick Ngassa Piotie, has written an open letter to the health minister to urgently implement a national diabetes education program. Of course, the good Doc Piotie joins us now to speak more to us about this. And Dr. Piotie, thank you for your time and good morning to you. This is quite worrisome. I think also the aspect that a lot of South Africans do not know that they actually are living with diabetes. What could you attribute this to?
Good morning to Melo and good morning to your viewers. The reason why there's so many cases of diabetes that are undiagnosed is because mostly type 2 diabetes can remain silent for many, many years, meaning the person having the disease might not have any symptoms, just because the high level of blood glucose in the high level of glucose in the blood will have impact progressively on the body. So in the first 5 to 10 years, it might be completely silent, and the person living the condition will not be aware of that at all.
Yeah, and I mean, 4.2 million South Africans do live with diabetes, we understand, according to StatsDoc, and 45% of these individuals are actually undiagnosed. You're saying it's at a point where it's become a public health crisis?
I would say so. I would say so because for many reasons. First of all, diabetes is the #2 cause of death in South Africa, the #1 cause of death in women. So you have diabetes killing more people than HIV. That on its own is already a cause of concern. And then you have the projection in terms of the number of cases that would increase over the years, and it's quite frightening because the International Diabetes Federation is estimating that from today to 2045, the increase will be about 134%. So we'll be more than doubling the number of cases that we already have at the moment. So that's really concerning. And then we can look at the cost implication in terms of not only the human costs, the societal costs, but also the economic costs.
Right.
The number that you referred to, the 68 billion, it's only for the lower limb amputation. That doesn't include those people who have dialysis, who need dialysis. That doesn't include the people who have had strokes and others. And obviously, diabetes usually affect people at a relatively middle age, 45, 35. These are people who are still at the productive years of their life. So having them living with complication of diabetes has really the devastating impact on their families. So as a result, we do believe that if nothing is done urgently, the crisis will just get worse and worse in the future.
Right. So with this enormous strain on, the public healthcare system, which you've just elaborated on, also on the individuals who are diagnosed with diabetes, their families, the public healthcare sector, also the economy and the fiscus, as you've just mentioned, Doc. I mean, what's then your appeal to the Health Minister, Dr. Joe Phaahla?
So what is happening in this World Diabetes Day, it's the theme for the year from the International Diabetes Federation is Education to Protect Tomorrow. And that theme is really befitting to the South African context because when you look in the public, what the different surveys and studies have revealed is that the knowledge of diabetes is very poor from the people living with the condition themselves, as well as from the healthcare worker who often don't comply to the basic management diabetes guidelines. So we realized that there is a need to beef up, to invest more in diabetes education. The reason for that is that diabetes being a chronic condition, adopting skills that allow the person to live on a daily basis is very critical. It's unlike, for example, HIV, where an individual needs to just take 1 pill a day. With diabetes, that's not the case. You need to check how you eat. You need to check to exercise. You need to make sure you take your medication at the right time, at the right dose.
Right.
And eventually, those elements exert quite a burden on the person living with diabetes. And therefore, there's also a mental health aspect to it. So it's really a complex condition that needs the person living with the condition to be equipped to do better and to have better health outcome. And obviously, it also needs a healthcare team that is knowledgeable and really supportive to that person and the family. So that's why we believe that it's important that we make it a priority in South Africa to invest in diabetes education for the healthcare providers as well as for the people living with diabetes.
And on that note, we'll leave it there. And I appreciate you speaking to me this morning about this very important issue. The chairperson of the South African Diabetes Alliance, Dr. Patrick Ngassa Piotie, thank you so much for your time this morning.